You want healthy, glowing skin, but with all the products, trends, and conflicting advice, it's hard to know what actually works. I understand. I am Dr. Tiina, a former cardiologist and specialist in the skincare development and cosmetic safety expert. I've spent years studying the science of skin. Welcome to Meder Beauty podcast, where we uncover what really matters, break down the science, and give you real expert-backed skincare advice. Whether you're looking to achieve radiant, healthy skin, curious about anti-aging, or want to understand what's really in your product, you are in the right place. Rooted in science and the truth about what your skin actually needs, we'll have in-depth conversations with leading dermatologists, medical experts, and skincare brand founders to bring you the latest innovations, evidence-based insights, and industry secrets that truly make a difference. We are so happy you are here. So let's go! In the previous episode, I discussed the sun damage to our skin, but I literally didn't say anything about the protection of our skin against ultraviolet. We have a lot of methods and a lot of products which can help you to protect your skin properly, so you will not suffer from the ultraviolet damage, you will not be in the danger of premature skin aging, and most importantly, you can decrease the risk of skin cancer development. Because ultraviolet damage, unfortunately, that's not only about aesthetics, it's mostly about your skin health and your health globally. So, as I mentioned in the previous episode, it's very important to understand tanning is not a good sign, because when your skin is tanned, even if you didn't develop sunburns, you feel perfectly comfortable, is still the sign of the damage by ultraviolet type A. So, we protect the skin not only from discomfort, redness, inflammation, or pain, we protect our skin from the tanning as well. Some amount of tanning is protective, so very light change of color can be beneficial, and it is impossible to block it completely, except for the situation when you don't live indoors or you're always wearing some very protective, very thick clothes. But if your skin is tanning a little bit more significantly, then it means that you are in danger. We should avoid it. And when we speak about the sun protection, most of the time, this conversation is very much focused on the sunscreen. But let's start from the idea of the smart protection of the skin. And it's much more than sunscreens. Sunscreens are good. They're amazing in protecting our skin against the ultraviolet. But it cannot be your only method of protection. Sunscreen, it is a part of your sun protection strategy. Part in the sun protection strategy, it is antioxidants, because ultraviolet damage of the skin is based on the oxidative stress, because the ultraviolet radiation excites structure on our skin, creating the huge amount of free radicals circulating around cells and damaging them. From the direct damage to the skin structure till the damage of the DNA. In our body, we have the natural antioxidant protection. Amongst it, it's antioxidant called glutathione, superoxide dismutase, catalase, glutathione peroxidase, thioredoxin, and vitamin C. Also, vitamin E is also the part of the natural sun protection. We should not try to stop all free radicals activity, because we need free radicals as well. They help us to activate the autophagy. They help us to eliminate the damaged cells and damaged structures from our skin. So, speaking about the antioxidant protection, we are speaking not about the total victory of the antioxidant activation. We are speaking about the antioxidant balance. And when we are using some antioxidants systemically, like antioxidant supplementation, we should be very strategic about it, because the antioxidant supplementation can be excessive. So every time when you are thinking about take some supplements, it's always a good idea to be consulted with a doctor or medical professionals to be sure that you will benefit from the supplements and it will not be unsafe for you. But speaking about topical protection with an antioxidant, we are in a slightly different situation. Why? Because our skin is exposed to the excessive free radicals activity. And sun protection means that we protect our skin against the ultraviolet. And when your skin is exposed to the ultraviolet, it means that it exposed to the huge amount of the free radicals. And unfortunately, another factor, the air pollution, can multiply and intensify the free radical damage of the skin because air pollution, it is another source of oxidative stress for our body and our skin. All these microparticles, dioxins, other toxins circulating in our polluted air attack our skin. So when we are using skincare, it should be antioxidant as well. And it's one of my core beliefs. Then everyone should use antioxidant-based skincare on the daily basis. What are topical antioxidants which we include in the daily skincare, especially during the sunny period of the year? It can be vitamin C, the easy solution, but like everything what seems to be easy, it is tricky. I've been speaking about vitamin C in the episode about vitamins, and I mentioned that vitamin C, it is a very unstable molecule. And especially when it's exposed to the ultraviolet, it can be easily destroyed. That's why, by the way, all the products containing the vitamin C should be protected from the direct light. So it should be in the dark glass or it should be kept in the non-transparent plastic. If it is in some transparent packaging, it will be damaged. Believe me, it will not work like this. So vitamin C, it is good, it's not expensive, but in the same time unstable and unfortunately not the most efficient ingredient, speaking about the smart sun protection. Another skin identical ingredients which we are using to protect the skin during the summertime, it is vitamin E. Vitamin E is much more stable. And it protects cells' membranes. It protects our cells from free radicals. It is well known to be able to protect cells' DNA. So it's some kind of ingredients which really decreases the risk of the skin cancer development in your skin. But that's another thing about the vitamin E. Not all vitamin E are equal. We have 8 different types of the vitamin E, and you will never know what type of vitamin E was used in the skincare products by the name on the label, because on the label it will be tocopherol or tocopherol acetate. But the shape of the vitamin E and the type of vitamin E is much more important. So please pay attention. If you see then it is alpha tocopherol, it is protective. It is an antioxidant for your skin. If it is the gamma tocopherol, it is protective but not for your skin. It's protective for the product because it's used as a preservative. So we need only alpha tocopherol in the specific stereo shape called RRR, so 3 right angle in these molecules. It can be used as an antioxidant. We have very powerful antioxidant, resveratrol, which is especially good for mature skin because it has this antioxidant ability. It protects our skin from the ultraviolet damage, but in the same time, it can act as an anti-inflammatory protection. And also, especially biofermented resveratrol can boost collagen synthesis in the skin and suppresses the activity of collagen-eating enzymes. So if you see resveratrol in the skincare, it's especially good for the skin 40 plus Another great antioxidant, also quite fragile and has this problem of stability, but easier to preserve than vitamin C, and also it is fat-soluble. As vitamin E, fat-soluble vitamin, the coenzyme Q10 will be the part of cream, emulsions, moisturizers, and probably some facial oil. For example, in Meder, we have this protective facial oil called Vitalon based on the coenzyme Q10. Coenzyme Q10 is an antioxidant and it's a very energizing ingredient. And also it can help brighten the skin. So when you see coenzyme Q10 on the label, it is so good for tired skin, for the skin with a tendency to dull skin color, skin with pigmentation issues, and for mature skin as well. We have the whole group of antioxidants used for the eye health, but in the same time, they are very good for the skin health as well. They are astaxanthin, zeaxanthin, luteolin, and luteol. All of them are good for eyes. They are protecting eye retina from the ultraviolet damage and help to preserve cells in our eye from the damage and age-related changes, and they do the same for the skin. Also, all of them, they are slightly brightening the skin, so they're really great antioxidant for all types of skin, but in the first place, skin with pigmentation disorders. Green tea extract. Another extract activating autophagy simultaneously with an antioxidant protection. So green tea I will recommend in the first place for people with the skin prone to the inflammation. It is a great ingredient for anti-acne skincare and sun protection for people suffering from an acne or dermatosis. But also it is a great ingredient for everyone with mature skin as well. Another ingredient which seems to be simple, it's aloe vera leaf juice extract. Yes, we have a lot of aloe vera in the product designed to treat sunburns, but it can be used for the protection as well. So if you are using some aloe vera based gel, you can apply it before applying sunscreen because it contains antioxidant, but also it contains powerful anti-inflammatory substance called aloesin. Another anti-inflammatory antioxidant is a Centella asiatica leaf extract. Also great extract with very high anti-inflammatory properties. We are using it a lot for sensitive skin. Also, it is very good for everyone suffering from all types of dermatosis, but especially from rosacea. And also Centella asiatica helps to reduce the damage caused by the intense care with retinol. Centella probably is one of the very few ingredients which is able to suppress the development of retinoid dermatitis. So I always recommend to use Centella-based product for acne patients who are undergoing the Accutane treatment or other systemic retinoid treatment. They are in the very high danger of the ultraviolet skin damage because their skin is very vulnerable and they need the Centella-based skincare to apply on the skin twice a day, even if they avoid as much as they can the exposure to the ultraviolet altogether. We are using a lot of flavonoids and isoflavonoids derived from berries, derived from different kinds of colorful vegetables and fruits, and they can be derived from the citrus. What is interesting, we don't use citrus as extracts as a part of the sun protection. Why? Because many of citruses, they can be photosensitizing. And also they contain a lot of citric acid, so it can acidify the skin and make it more vulnerable to the ultraviolet. But some substances in the citrus are so powerful as an antioxidant, and also they help protect the skin DNA from the ultraviolet damage. I love to use niacinamide. It's one of my very favorite ingredients. It has antioxidant properties, but also it activates the synthesis of substances called sirtuins, which are DNA repairing and which are able to prolong shelf life. In the same time, they are energizing skin cells, helping to produce naturally more of protective substances. They energizes and activate the production of essential skin lipids called ceramides. So they help to restore the lipid barrier of the skin and decrease the oxidation of lipids in the skin. And also, niacinamide is well-known collagen booster. So it's one of the ideal ingredients to use alongside with sun protection. So if you're thinking how you can optimize your summer skincare, niacinamide-based product should be your best friends. And recently it was found in probiotics, especially like lactic bacteria, lactobacillus or lactococci, used now very often in the probiotic solutions designed for skincare. They help to restore the microbiome, and the healthy microbiome is very protective for your skin. When you protect your microbiome from damage, you protect your skin from ultraviolet damage. And also it can be caffeine. Caffeine is also an antioxidant, helping to maintain your capillary strengthened. So caffeine, it's really good ingredients for people suffering from puffiness, under eye bags, and also for people with pigmentation disorders, because caffeine has this brightening property, and also it is energizing, so it helps to activate a lot of metabolic processes in the skin. I cannot stay away from the most powerful anti-ultraviolet antioxidant called rosemary extract. Rosemary extract is very rich in carnosic acid, which is absolutely unique. And actually, rosemary was used in skincare since the 12th centuries. It was the essential part of water of emperatrice, created all Hungarian water, known from the 12th centuries in medieval Europe, which was used for skin protection and skin brightening. Rosemary extract is unique because the carnosic acid is probably the most stable antioxidant you can find. How antioxidants work? They interact with free radicals, but this interaction destroys the antioxidant itself. So the antioxidant molecule is converted to something else. And this something else, most of the time, that's another free radicals. Fortunately, it's a little bit weaker than the initial free radicals causing this damage. But still, we need the new antioxidant to destroy this second generation free radicals. That's why it's very important to have not one, but a few antioxidants in the skincare formulation, because once the first one is destroyed, the second one can continue its work. So they protect each other and make the skincare formulation much more efficient. But carnosic acid in the rosemary extract is very independent molecule. It can be converted 7 times before it's destroyed by the free radicals. So it can help with the antioxidant protection, which is 7 times higher and more efficient than protection by the vitamin C. That's why I love it so much. And actually, I use it in the Vital Long formulation of the facial oil as a booster of the antioxidant protection. And everything what you eat help to protect your inner side of the skin from free radicals, from the ultraviolet damage. So it is not only the skincare itself, it's also your diet should be protective during the sunny period of the year. And the best example of the antioxidant-rich diet, it is a Mediterranean diet. When you have fish, when you have seafoods full of the protective fatty acids, and also you have vegetables, you have salads, you have all this beautiful organic oil like olive oil, sunflower, grapeseed oil, beans and corns, and berries and fruits, pomegranates, grape, everything which help protect your skin from the inner side. And the good news for everyone who loves coffee, it is antioxidant as well. alongside with green tea and black tea, dark chocolate, and red wine, full of anthocyanins. Just remember, it should be moderated, because the red wine, it's not only antioxidant, also psychoactive substance called alcohol. And we have a lot of sun protection supplements, which you can find now in the pharmacy, you can find online. Probably the first sun supplement which should be mentioned, it is a vitamin D. Because the main function of the vitamin D, yes, its synthesis of vitamin D is activated by the ultraviolet, but in the same time, in the moment when the vitamin D ergocalciferol is synthesized, it starts to stimulate autophagy, protecting the skin from the excessive effect of the ultraviolet. It modulates the immune response, and it suppresses the inflammation in the skin. So, for people who are in higher risk of the ultraviolet damage, for example, if you are living in the very sunny area of the planet, if your skin is more vulnerable, I will say a few words about it a little bit later. So the vitamin D supplementation can be very beneficial for you. And also, medical professionals advise and recommend to use vitamin D not only during the winter time, but also as a preparation of your skin for the sunny season. But it's always a good idea to test your vitamin D level to be sure. Do not overdose it. It can happen. And to be sure that you are not in the deficiency, because if you are in the deficiency, you are in higher danger of ultraviolet damage amongst anything other. So you should compensate the deficiency and get vitamin D essentially. Another of sun supplements which has a long history of using and which is beneficial and quite safe, it is a beta-carotene. Most of the time it's derived from vegetables. Main sources they are carrot and pumpkin and other yellow and orange vegetables. Beta-carotene helps to protect the skin more cells membranes, and it is a well-known antioxidant as well as a source of natural retinols in our body, which maintains a healthy skin cells renewal, what is very important part of the skin natural defense system. In the last years, you can find sun supplements based on the other carotenoids like lycopene, astaxanthin, lutein zeaxanthin. They are prescribed and recommended by ophthalmologists because they are well-known supplements for eye health. So if your ophthalmologist prescribed you this supplement, you know that you are supplementing your skin at the same time. Some vitamins, vitamin E, vitamin B3, niacinamide, vitamin C, coenzyme Q10 in topical skincare, and as a supplement can help. Coenzyme Q10 is prescribed or recommended most of the time by cardiologists because it helps to protect the heart and vascular system from damage, most of the time from mitochondrial damage. Also, different supplements based on the polyphenol, like green tea, red grape, or pomegranate cell supplements, they can be used for the vascular health. They can prevent, for example, the heaviness of the leg and help to maintain your capillary health quite efficiently. So they can be recommended for people suffering from varicose vein or rosacea, but in the same time, they help to reduce the ultraviolet damage of the skin. Resveratrol, obviously, it makes a part of the menopausal supplements in many cases, as well as saffron. Lipoic acid is well-known antioxidant, and some people, they are genetically predisposed to the lipoic acid deficiency. So if you have some genetic test and you found this deficiency in your genes, it's always a good idea to compensate it by supplementing lipoic acid. And also the very interesting ingredient called polypodium leukotomus, which is used by some sunscreens brand as a part of the skin sun protection. Also recommended, and I always recommend it for people suffering from acne, suffering from rosacea, atopic skin because it works really well and helps to create some additional layer of the sun protection for people in higher risk of sun-induced damage, and probiotics. Now there are specific supplements based on the probiotics, which helps not only restore the digestive health, but also helps to protect your skin from the ultraviolet damage. Who needs the supplementation? And who needs to be very careful about sun protection? There are some people who are exposed to the ultraviolet damage more than others. And when they're living in some tropical area, in the sunny area of our planet, they are in really high risk. So they should use all methods and all means to protect your skin more efficiently. One of the factors which increases your risk to the ultraviolet damage, it is high stress level. So if for some reason you are exposed to the higher stress, your body is exposed to the higher level of cortisol, stress hormone. And cortisol, it is the hormone which increases the risk of oxidative damage of the skin, as well as it can be the damaging factor for your capillary, for your vessels, for heart, digestive health, and even for lungs and other organs. So everything which helps you to moderate stress, including healthy sleep schedule, including mindfulness practice, meditation, and other methods of the stress control, should be highly welcomed in your life. People with light skin, fair skin types, which we call first and second phototypes by Fitzpatrick, with fair skin color, light eye color, and fair hair color, they are predisposed to the higher level of the ultraviolet damage because their skin has less efficient natural protection. Especially, it's important for people with Celtic background or Celtic heritage, and especially for people with red hair, because they are only category of people who has less of melanin produced by the pigment cells. So they should be very careful and should use some additional ultraviolet protection, as supplementation can be a good idea. People with a higher skin photosensitivity caused by different factors. I will come back to this a little bit later. If you are smoking, you expose your skin to the air pollution. So if you're living in the big city, if you're living in some geographical area with more polluted air, or if you're smoking, you are in higher risk. So you should protect your skin more globally. Also, people abusing the alcohol, they are in higher risk of the ultraviolet damage, as well as many other disorders. People who are living sedentary lifestyle, so they have low level of physical activity. Also, they're in higher risk of the ultraviolet damage. What is the low physical activity? If you have 180 minutes or more of physical activity during the week, you are good. When you have this 180 minutes, your body produces enough of antioxidant, your collagen synthesis is out of danger, and even hyaluronic acid produced by your skin in the necessary amount to protect your skin from the dryness, from the loss of the water. But if you don't have this 30 minutes of physical activity every day, you are in danger, unfortunately. As well as people who eat unhealthy, and especially for people who love so-called Western diet. It is a diet which increases the risk of all inflammatory changes in your body, including acne, including skin inflammation, but also it increases the activity of oxidative stress. If you eat too much of sugar, how much of sugar is too much? Almost 90% of it. So you should really limit your access to the sugar and sweets every day. People who eat too much of red meat, it's more often than once or maybe twice a week for people with different heritage and different backgrounds. And if you drink too much of cow milk or eat products derived from the cow milk, for one exception, for people who have this high level of taste in their body, so they can digest the milk more efficiently. And they are mostly people living in Scandinavia with Scandinavian background. Also, all kinds of inflammatory disorders and inflammatory condition, including overweight and obesity, which is pro-inflammatory body condition, increase the level of oxidative stress, so increase the level of ultraviolet-induced skin damage. People with increased amount of chromophores in their skin, so if your skin is inflamed, if you have some hematomes, or if you have some pigmentary disorders, pigment spots in the skin, it's a vicious circle. It increases the risk of the future ultraviolet damage as well. And obviously, people suffering from the compromised skin barrier, some skin trauma, repairing after some aesthetic procedures, and people with unbalanced microbiome because they've been using too much of disinfectant or been exposed to some chemicals, or they've been using some inappropriate skincare, killing their microbiome and compromising their microbiome. And also people in the category 55 plus, because the oxidative stress, it is a part of our age-related changes. And a few words about sensitizer for the skin. We have photosensitizing medication, which can increase the risk of ultraviolet damage in your skin if you take this medication regular basis. And we have a photosensitizing skincare. So once again, if you're using skincare based on photosensitizing ingredients, it will put you in the higher danger of ultraviolet skin damage and in the danger of premature skin aging, even if it is skincare labeled as anti-aging skincare. It can boost the collagen synthesis in your skin, but it will increase the risk of the ultraviolet damage. And once your skin will be exposed to all benefits, will be destroyed, and your skin will be more damaged than before. So paradoxically, you can be higher risk of skin aging using some anti-aging skincare. So what are among the photosensitizing skincare? This is a skincare based on the active form of retinol, such as retinoic acid, retinol aldehyde, retinol palmitate. All of them can increase the risk of damage in the skin, also because the retinol is an active chromophore. It absorbs ultraviolet. So first of all, never use retinol in the morning. And second, please avoid retinol and retinol derivative-based skincare during the sunny period of the year. That's no sunscreen. Protect your skin when you are using photosensitizing skincare. Another well-known photosensitizer is the hydroxy acids category of ingredient. So glycolic acid, kojic acid, pyruvic acid, and even lactic acid in the concentration higher than 8%, all of them can be photosensitizing, increasing your risk of premature aging, hyperpigmentation, all kinds of pigmentation disorders, and so on. Salicylic acid in a concentration higher than 2% salicylic acid-based product used for more than 8 weeks in a row. So I suggest to be very careful with salicylic acid during the summertime. Almost all essential oils can be photosensitizing, so you are not out of risk when you are using organic or so-called natural skincare. You can be in the higher risk. Alcohol in the skincare, benzoyl peroxide, one of the most common ingredients in the anti-acne skincare, and now hopefully it will be on the way to be banned because also it's so much unfriendly to the microbiome. It's literally disinfecting. And it is very unstable, so I really hope benzoyl peroxide we will not see on the label in some near future. Some oils rich in palmitic acid and stearic acid, and pigments in the makeup. Red and blue pigments can be photosensitizing because they can act as a chromophore. If you're using them in dry form, it's relatively safe. But if you use some liquid blush or eyeshadow, that can be bad for your skin and can cause a hyperpigmentation and damage your skin. Speaking about photosensitizing medication, many of antibiotics, including topical antibiotics, so antibiotic cream, if you're using them to treat some skin infection, put you in the danger. Corticosteroid, all steroid ointments, all steroid creams, they're anti-inflammatory, but photosensitizing in the same time. So even they are used for treat insect bites, they will increase the risk of sunburn and the ultraviolet damage. And bad news for everyone treating acne with systemic retinol, you should stay indoors all the time when you are undergoing therapy with Accutane or acitretin or isotretinoin. And a couple of months later, after you finish this therapy, you should be very careful. Same for chemotherapy. If you're undergoing the chemotherapy, it's better to stay indoor and do not be exposed to the ultraviolet during the daytime. Stay safe. Enjoy the sun in the early morning and in the late evening. And bad news for women using oral contraceptives. Most of them, they're photosensitizing. Bad news for allergic people when you are taking antihistamines, including Benadryl and Claritin, you are in the higher risk of the ultraviolet damage. Bad news for everyone who are taking Advil or Tylenol time by time, they are photosensitizing as well. And antidepressant, they are known to be photosensitizing. So if you are taking one or more of these types of medication on the regular basis, you need very intense sun protection, and you should avoid being exposed to the ultraviolet during the midday at least, and better during the day as well. So what is the smart sun protection strategy? First, your lifestyle. Higher the intensity of the ultraviolet is, more active you should be physically active, and you should eat healthier. Mediterranean diet will be your best choice. Another thing to keep in mind, it is an inflammation control and weight control, because overweighted people and people suffering from obesity, they are in the higher risk of the ultraviolet damage. So anyway, Mediterranean diet is good for you, and Mediterranean diet is good for the weight control. Also, you can include intermittent fasting, like include a couple of days or months when you stay out of food for 24 hours or 36 hours. It can help to activate your autophagy. So if you're comfortable with it, it can be really good for your health. Another point, it is probably supplementation with antioxidant supplements. If your doctors and medical professional, your consultant are good with this idea, and vitamin D supplementation, especially if you know you will be exposed to the intense ultraviolet radiation. And if you can reduce the photosensitization as much as possible, it would be the best idea ever. First, with the skincare. You should stop chemical peels. You should stop laser resurfacing procedures. And you should stop use of photosensitizing skincare, including retinol-based skincare and acid-based skincare, a few weeks before the ultraviolet become intense and you know you will be exposed. If you live in some sunny area of the planet, you should stop all the stuff when the ultraviolet index is on the level 3 or 4, not when it is on the level 6. If you are living in some northern area, but you are planning holidays, so please start to be careful. At least 2 better 4 weeks before you're going on holidays. And obviously, skincare, which maintain your skin health, so which maintains your skin moisturized, calm, comfortable, and sunscreens. We have the huge choice of sunscreen filters, especially if you're not living in the United States of America, because in the USA, unfortunately, the regulation is a little bit old-fashioned. FDA didn't register new sun filters for many years. So unfortunately, American consumers, they don't have an access to many of modern sun filters. We have 3 categories of sun filters in sunscreen. First, they are mineral, or we call them sometimes physical sunscreens. Another category, they are chemical, or nicer name, organic sunscreen filters. And the last category, it is a combined category when we are using mineral and organic sunscreen filters together, creating the broad spectrum protection. How mineral sunscreen filter works? These filters, they are titanium dioxide particles and zinc oxide particles. They simply sit on the top of your skin without penetrating into the stratum corneum. They're just covering your skin with this invisible mineral shield. This mineral shield physically blocks the penetration of the ultraviolet rays or scatter ultraviolet rays. And the best thing about mineral filters, they are not transformed by the ultraviolet. Ultraviolet cannot damage titanium or zinc. It will be still zinc or titanium even when it was exposed to the ultraviolet rays for many hours. And it is a big advantage of this filter. Also, they are generally well tolerated. They are not allergenic, so they are good for people with very sensitive skin. And they are very good for children because the children's skin is much more permeable and much more vulnerable to all chemical substances. But they have a disadvantage as well. They are not comfortable. Especially zinc, it can feel quite heavy. And when it is heavy, it's easy to apply, so people start to avoid to apply it in the recommended amount. And also it whitens the skin, which is uncomfortable, especially for people with darker skin types. Organic or chemical sunscreen filters, they are much more comfortable. And now we have a lot of progress in the cosmetic chemistry of sunscreen, so new organic filters, they have a lot of advantages. They can penetrate into the stratum corneum, and sometimes they even can penetrate into the higher level of epidermis, where they absorbs or scatters ultraviolet radiation, but they are not minerals, so they can be transformed by the ultraviolet into something else. So literally, they act as an antioxidant. Some of them, they are more stable, and I can say that modern organic sunscreen filters, they are not only more stable themselves, they are also stabilized. We have now a lot of organic sun filters, including these traditional filters like oxybenzone or avobenzone, microencapsulated with special silicones microcapsules, so they are not oxidizing so easily and they protect the skin much more efficiently, and also it makes them much more comfortable. The most common sun filters used around the world, and they are affordable, they are efficient. They are avobenzone, oxybenzone, octinoxate, oxysalate, homosalate, and some others. There is a lot of discussion around it, especially during the last year, when you see influencers and bloggers who are speaking about danger of the sunscreen and even saying that you should not use the sunscreen at all because the use of sunscreen can be more dangerous than ultraviolet itself. It is not true. We should protect our skin from the excessive exposure to the ultraviolet. So there are a lot of methods, and the easiest method is do not go out when the ultraviolet is intense. So say goodbye to beach holidays and the mountain holidays if you don't want to use sunscreens. But also sunscreens now, they are much more safer. Yes, very probably sunscreens used in the 90s and some of maybe cheap, not of good quality sunscreens even nowadays, they can be harmful for the skin. But most of sunscreens on the market, they are modernized. And even avobenzone and oxybenzone, now they are much more stable. When we discuss about the potential danger of the sunscreen, we are discussing about this systemic absorption effect. So it was found that some chemical filters can be found in the bloodstream and can be found in the urine and even in the breast milk of women. But now, as we know about the danger, the industry is trying to prevent it And now all filters, they are tested to the danger of the systemic absorption. So I will not say then we are out of the forest completely, but modern sun filters, they are much better than they've been years ago. And we should use it. And if you choose between mineral sunscreens, yes, probably it's safer. And myself, I will recommend a mineral-based sunscreen for everyone with compromised skin, with damaged skin, with people with rosacea, people with highly sensitive skin, and for babies, newborns, and young children. I will recommend do not use sunscreens and to minimize the use of any cosmetic products because the skin is very permeable. I will recommend to protect them with clothes, with some small rash guards, and do not expose them to the ultraviolet when it is intense. It's the best way of protection. But in the same time, it's so difficult to use only mineral protection because it's less comfortable. And the best sunscreen, it is the sunscreen you wear with pleasure on the daily basis. So the best means of protection for me now, they are broad spectrum protection, combining mineral sunscreen so we can use the lower concentration of titanium dioxide and zinc oxide, alongside with modern encapsulated organic filters, which create this pleasant and comfortable texture. So you can use it on the daily basis without any problem. And also choosing sunscreen, we should choose the SPF factors, right? And that's a huge stereotype and myth behind the SPF. Then SPF is about the time you can safely stay on the sun. So I heard like people say, okay, my SPF protection is 30, so I will be safer 30 minutes later, or even 30 times more. It is not about the time at all. It defines an amount of solar exposure which you can shield your skin from. With the SPF 30, block about 97% of the ultraviolet type B rays penetrating into the skin. SPF 50 blocks about 99% of ultraviolet type B rays. For ultraviolet type A protection, we are using higher amount of sunscreen filters. And it is impossible to create the sunscreen with a protection higher than 50. And now it is even forbidden to use this SPF 70 or SPF 90 labeling because it's not true. And me personally, I recommend to stay with SPF 50 or SPF 50 plus for all the time when you are exposed to the ultraviolet with an index higher than 3, especially if your skin is compromised. And as you see, there are a lot of medications, there are a lot of skincare, a lot of factors increasing your skin vulnerability against the ultraviolet. And also there are a lot of situations like air pollution, when your skin will be in the higher danger. So for me, SPF 30 is mostly for the protection during the working days in the city when the air is not polluted too much and sun is not very active. Also, the thing to keep in mind, then sunscreens, they are tested on the back skin of healthy young volunteers, preferably male. And we test the ability of sunscreen to prevent the sunburn, to prevent the redness and inflammation in the skin. If it blocks the penetration of 99% ultraviolet rays into the skin of the back of 25 years old, healthy male person, it doesn't mean that it will block the penetration of the same amount of the ultraviolet in the skin of the face of 60 years old woman, because skin characteristics, they are different. So it is very subjective classification. So please choose 50 and 50 plus sunscreens. So smart skin protection against the ultraviolet should be based on the real situation, real ultraviolet intensity, air quality index, and your individual behavior. It should be based on your skin condition and types. It should be comfortable. It should not cause physical or any emotional discomfort. If you don't like how you look when you apply the sunscreen, you should look for something else. There are a lot of sunscreens now which can be much more comfortable and much more beautiful on your skin. Also, sunscreen, I believe it should be affordable. It should not be too expensive for you, because if you feel like it is expensive, you will never apply the necessary amount and you will apply it rare. So please look in your category of sunscreens. And it should be manufactured in the legal facility, not at home, not in the kitchen. And in the United States of America, sunscreen should be manufactured by the facility registered by FDA, even if it is somewhere in the foreign country. And it should be independently tested and non-sensitizing itself. So the rules of modern sun protection are all about sun care became a skin care. So they are not only sun filters, that's some antioxidant protection, and it can be combined with non-photosensitizing antioxidant skincare, which help to protect your skin more efficiently. And also it should be beautiful, it should be comfortable. I believe that everyone should have 3 sunscreens on your shelf. First sunscreen, it is a sunscreen for days when you are not exposed to the ultraviolet for a long period of time. So from Monday to Friday, when you work somewhere in the office. So you see the sun in the morning, maybe during the lunchtime, if you're lucky, and at the evening time. Okay, here you can use even makeup foundation. If you are not living in Florida or Israel or in Africa country or in the Mediterranean region during the summer period. Also, it's a good idea to have this solution tinted. It helps you to apply it properly, and in the same time it creates this beautifying makeup effect, and it should get antioxidant inside. It should be the part of your skincare. For weekends or holidays, when you are exposed to the ultraviolet for longer period of the day, you are sightseeing, or you spend some time on the beach, or you are working with your children in the park or doing some activity, you should have more intense sunscreen. So for weekend, I always say go for 50 and 50 plus, but also it can be very comfortable, so it can be slightly lighter, and it can be renewed easily during the day. I always suggest you have makeup removal towels with you and the sunscreen to reapply it during the day. Just please do it in the shadow. Do not do it under the direct sunlight. And for holidays and for your active sport, if you are the runner or swimmer or surfer or tennis player, you should have the most intense sport sunscreen, which will be 50 plus as well, but also it should be water resistant. And it should be applied very carefully. It's more adhesive to the skin, but also it should be renewed. If you are using organic filters as a sunscreen, it should be renewed not even every 2 hours, but every 80 minutes, 1 hour and 20. It's an average time when organic sunscreens stay stable. And a few advices for different skin types. If your skin is sensitive, if you're suffering from rosacea, your sunscreen should be oil-free. And preferably, it should be based on mineral filters because they are more hypoallergenic. And also, it should be accompanied by the specific skincare for sensitive skin and for rosacea-prone skin. If you are suffering from an acne or your skin has a tendency for the oiliness, once again, oil-free sunscreen is your choice. Mineral sunscreen is also good, but for most of people, broad spectrum protection or even just organic sun filters can be more comfortable, and it is okay when it is accompanied with an anti-acne skincare. But remember, no retinol, no benzoyl peroxide, no acids, and no even salicylic acid. Use alternative. There are a lot of prebiotic, probiotic-based acne skincare now, including Medar. If your skin is mature, if you are entering menopause, or if you are enjoying your menopause here, remember that it is very important to approach the sun protection globally. So the diet, the lifestyle, stress management is also very important, but your sunscreen should be moisturizing. Now, there are a lot of sunscreens, and they texture based on oils. They include hyaluronic acid, they include glycerin, they include many of moisturizing ingredients. They enriched with antioxidant, and also you should use your age well skincare alongside. But once again, remember, no retinol during sunny period of the year. If you need to apply sunscreen, if you will be exposed to the sun rays, retinol put you in danger, as well as acid. So please use peptide-based skincare. Growth factors, plant stem cells, a lot of antioxidants. It will be amazing for your skin. And amongst peptides, there are many of very efficient collagen boosters, even better than retinol. So, stay smart, stay safe, use sunscreens, but remember, sunscreen is an essential part of the protection, but it should not be the only protection for your skin. Thank you for joining us today on the Meder Beauty podcast. If you found this helpful, be sure to subscribe so you never miss an expert skincare tip. Have a question or topic you'd like for me to cover? Send me a message at podcast@mederbeauty.com, and let's keep the conversation going. Also, you can visit mederbeauty.com and discover Meder Skincare, which I created. And if you enjoyed the show, I'd love if you left a review. It helps others find the podcast and keeps us growing. Until next time, stay healthy, stay glowing, and take care of your skin.